September 10th annually is World Suicide Prevention Day. The theme for this year, Working Together to Prevent Suicide, seeks to raise awareness on suicide prevention.
TVC News correspondent Ivy Kanu has more.
According to the World Health Organization, an estimated 800,000 people die by suicide annually, which equates to one suicide case every 40 seconds. And Nigeria now ranks among the top suicide-prone countries. Suicide has been linked directly to mental disorders, and it appears Nigeria is in short supply of psychiatrists relative to its population of over 200 million people. Practitioners in the mental health field believe that Nigerians have not come to terms with the rate of mental disorders and how those may lead to suicide. To mark the World Suicide Prevention Day, a 2-hour mental health training webinar was organized for media practitioners in Nigeria. The organizer, Dr. Memuna Yusuf Kadiri, is of the opinion that Nigeria needs a lot of awareness on mental health disorders and suicide in the country.
Media play a very significant role in suicide prevention. And what do I mean by that? In reporting cases of suicide, it must be done responsibly. Not only because of the person who has lost his or her life, but for the fact that that person has left behind family members, loved ones, colleagues. So reporting cases responsibly.
Dr. Memuna feels the government is not giving suicide the much needed attention, thereby living in denial.
A lot of other countries have logged in to have a suicide register, meaning in that country, if anybody should die from suicide, it's properly documented. Also, the National Suicide Prevention Lines.
A clinical psychologist at the Psychiatrist Hospital Yaba, Mrs. Chinyere Okonkwo, says suicide is not a spontaneous act.
There would have been things, some statements, he would have maybe even withdrawn, be more withdrawn than before. He would have tried to settle a few things outstanding, you know. He would have said few words that will connote finality, okay. There are little things like that.
They both agree on the need not to criminalize suicide.
Rather than them going to prison, they should be sent to the hospital for evaluation, assessment, and if they need help, get help.
For somebody to think of taking his life, the person must be mentally sick. We don't even need to do too much assessment.
Every year, World Suicide Prevention Day provides the opportunity for people across the globe to raise awareness on suicide and suicide prevention. Ivy Kano, TVC News, Lagos.
All right, joining us now on Skype is consultant neuropsychiatrist and founder, Pinnacle Medical Services, Dr. Memuna Kadiri. Dr. Kadiri, it's good to have you join us this morning.
Good morning.
Great. Now, you have been busy the last few weeks on this topic, build up to the day like this, enlightening people and trying to reach out. But there is a lot of debate now on the streets as to some of the causes of suicide. Some are saying that it's out of cowardice, others are saying it's out of frustration. Can you enlighten us more from this window?
The truth, thank you very much for this question, and good morning, Nigerians. The truth is that nobody really wants to die. And I don't think we forget so easily with the statement that Nigerians are the happiest people in the world. The question we should be asking ourselves is that what changed? The truth is that we are faced with a lot of challenges from the basic needs of life. And we won't just say because somebody is mentally ill. There's so many other issues that we are facing. COVID-19 happened. A lot of people are going through social, economic reasons, financial crisis, loss of job, redundancy, marital challenges. So when somebody is suicidal, we should never ever look at it as if it's an attention-seeking way. There are a lot of warning signs, red flags we should look out for. What are the statements people are making around us? What are their behaviors that they're exhibiting around? What has changed in their mood? When somebody says, look, I just believe rapture should take place now, or telling his or her relatives that, look, if I die, nobody will take care of me. That is a very heavy statement. It's a red flag. So please, Nigerians are not the type of people that will just, like the Asian countries where people will say, look, I want to just kill myself, maybe for honor reasons. In Nigerians, we love life. Life is beautiful. So when somebody actually says or carries out the act of suicide, is he or she is going through some chronic medical conditions like chronic debilitating pain, end-stage cancer, or maybe mental illnesses like depression or abuse of substances. So it's never a reason why we should just assume somebody is just seeking attention.
Maimuna, if I may come in here, we understand that COVID-19 has also exposed many Nigerians to suicidal behavior. Can you talk to us about that?
Obviously. When the World Health Organization declared the global pandemic, COVID-19, it came like a surprise, but at the initial stages, people, especially workers, they were happy, they wanted to rest and all that. But the reality dawned on us where we just knew that, look, we are totally not in control of this. Then, of course, the recession, the job loss, the redundancy, the economic challenges, and of course, recently in Nigeria, we can see all the hikes in everything, from fuel, to electricity. Some people will never get back to their jobs. So there are a lot of hardship that people are facing. And let's not forget that, for one person working, there's so many other people that he or she is responsible for. So all these are some of the things we are talking about. And some people are already vulnerable. Vulnerable because they have a traumatic life experience they are facing, or they've come from a family background where they are having other challenges. So we are not in a society where it's easy for us to stand up and speak out because of the discrimination and stigma still attached to people living with mental illnesses, including their families.
Now talk to us about the family as we know it used to be a great support system. And because of our cultures and tradition, we live in a very communal setting. How is that helping, or how is that changing, really?
It's supposed to be helping. In fact, we still have that as compared to so many other countries, what we call support system, what we call psychosocial support, where people will rally around you. If I don't see you in some days, I will reach out to you. But when you are also burdened with so much, you can only do a little. You can only do what you can do. In as much as we want to help other people, we are also looking inward to say, how have I helped myself? Do I have enough in abundance to give out? So these are some of the things we are looking at. If there's ease of livelihood in Nigeria, the burden of care, a lot of other things challenging, from the basic needs of life, shelter, food, accommodation, good roads, good health system, better education, all this will ease all the tension we are having. And of course, that will still come to embracing that communal life we are living. We are there, but we are doing something, but we are not as it used to be before, because things are really hard for everyone. And people are looking inward to check in on themselves first before they can give a helping hand to anybody. You can't give what you don't have.
All right, Maimuna, earlier you talked about, you said this is a mental health issue. So how then do we expand, or grant access, give access to Nigerians when it comes to mental health care, and then expand coverage for all Nigerians?
It's still very sad that in a country of 200 million people, we have one psychiatrist to 1 million Nigerians. It's still sad, and it's even going to get worse. Now SPS is open, there's exodus of doctors running. They are not walking, they are running out of Nigeria as fast as they can. Though suicide is a serious public health issue, but of course we do understand that when timely evidence-based intervention, and in this intervention, low-cost interventions are deployed, we will be able to prevent suicide. So the first rule is awareness, creating awareness, letting people know where there is help, be able to access the right people, the right places, and of course the right time. We have 8 standalone psychiatric hospitals in Nigeria. We have psychiatric hospital unit in all teaching hospitals. A lot of the federal medical centers have psychiatry unit, and of course we have a few mental health services. They are still not enough, but at least we have something. But of course, I want to use this opportunity to at least tell the federal government or the telcos, so you see this as a CSR, to deploy toll-free suicide prevention lines. We have no private people just helping in this space, but if there are toll-free suicide prevention lines, we can of course get the help from volunteers from the Association of Psychiatrists of Nigeria, National Association of Psychologists. These are professionals already in this field. Get them as volunteers to help mount these lines, and of course that will help ease the pressure already existing. People just want to talk. People want to be listened to.
Yes. I remember a few years ago you talked about the issue of decriminalizing suicide. Can you explain that to us more?
So there's a part of the law that is still existing in Nigeria that states that if you try to kill yourself, that means attempted to kill yourself or attempt suicide, is a misdemeanor still in our Nigerian law, meaning it equates to 1 year imprisonment. That means if you attempt to kill yourself and you don't die, then you go to prison. And from what I learned from our legal practitioner, this has been in the existence for 104 years old. Like literally, this is 2020. We're in the year 2020, and we still have this in existence. And so we are advocating that rather than we sending these people to prison or to jail, why don't you send them to the hospital for evaluation and possibly treatment? Because we do know that prison or going to jail is also incarceration. That will further deteriorate anybody that is already having an existing mental health issue.
All right. On a day like this, how best can the day be commemorated so we have and feel the impact of a day like this?
This is one of the ways. Right. Advocacy, creating awareness. There's so many activities that are ongoing all over the world. In fact, I was in the World Health Organization discussion that was going on right now before I came on board, where a survivor is talking about how she has survived it. So talking about it, creating awareness. There are people that are doing cycling around the world right now. People lit candle by 12 midnight, depending on the part of the world where you are in advocating about it. Having suicide prevention helplines that should be toll-free, so that if anybody is going through any challenge right now, before now, even today, and maybe afterwards, can have a safe space where they can talk to a professional and get the much needed help that they need. So the media play a very important role in helping to disseminate information to people, so that people can be aware to know where they can go to, the people they can reach out to, and of course available services that are in any country that they're in.
Okay. Now, from the records and the reports, about over 200 cases of suicide in the last 4 years in Nigeria, and over about 800,000 globally. Do you think that within Nigeria there could be some more cases unreported?
That's obvious. Obvious, because suicide is a taboo. People don't even like to discuss about it. It's very easy to say he or she died in her sleep. Nobody wants to have that word attached to their family. So that is highly underreported. I can tell you for free, it's highly underreported. We've had cases of suicide that I know personally, and people around me know personally, and family and professionals that we've never ever heard in the media. So yes, we can say in the last 4 years 200 cases reported in the media, but it's obvious that these are not the exact numbers. We don't even have a suicide register. We don't, there are certain things that we should have that will properly document what it is that we're having. And it's not because we want to report cases just like that, but for research case purposes, and for how to build strategies and systems that can help in the prevention of suicide. And that's why the team for the year is working together to prevent suicide. So I believe I strongly advocate that we should put systems in place. that will help in this working together to prevent suicide. Because it's
right.
a multidisciplinary, multifactorial approach that we need. It's not designated to any sector. Legal, health, justice, education, religious bodies, media, everybody. We need all hands on deck in working together to prevent suicide.
All right. Dr. Maimuna Kadiri, thank you so much for your insight, and thank you for what you're doing to create more awareness and reaching out to people. Thank you very much.
Thank you, too.